Hi, this is Bonnie Evans. I work at the Texas Institute for Excellence in Mental Health, and we've decided to put a webinar together for how organizations can get ready to roll out Wraparound.
And I'm Erin Espinosa. I work with Bonnie here at TIMH, as we like to call it. And so what we recognize is we've gone across the state of Texas and kind of had these conversations with organizations that we thought it might be helpful. We put a short little, I think we won't be more than 10, 15 minutes today, kind of giving an overview of what an organization needs to do to prep for Wraparound, because it's not as simple as just going to training and then adding it to the mix. Like it's a little more complicated than that. So you want to just dig right in?
Sounds good. Let's go ahead.
All right.
So this is just a brief overview of what we hope to cover in this webinar and just some basics of what Wraparound is and who it's designed for, as well as some things that you can do as an organization to prepare for Wraparound. And we'll go into more detail about those things later on in this webinar.
So this is just a framework for what we're covering, essentially. All right, excellent.
So what is Wraparound? Now, some of you probably know a little bit about Wraparound and some of you are probably really confused. So Wraparound is very different from case management. To start off with, it's actually a planning process. So it's essentially a way that we kind of organize and design support for families. It looks very different from case management. To start off with, you actually have a child and family team that essentially help with the whole planning process through identifying, maybe what some of those needs are, to even brainstorming strategies. So that team approach is very different from case management.
Yeah, and to learn more about how Wraparound works in a team approach, we actually have a webcast on our companion website, texassystemofcare.com, that we'll link to this webcast on team roles in the Wraparound process. It's about an hour long. You can get LPC, MSW, and LCDC credit for watching it. So if you want to know more about that team dynamic and how it works, we encourage you to watch that. But if you look at the bottom of the slide here, you see the picture there on the left on Super Case Manager to the rescue. So, and then on the right you see the Wraparound team, and we like these pictures because they kind of pictorially describe what we're talking about here. Like sometimes when we're working with children and families that are really struggling, we think that we can go in there and they've never had us as a case manager before, and by gosh, I'm in here now, Erin Espinosa, case manager extraordinaire, is going to come in and we're going to fix all this. And so we try to go in there all by ourselves, and what we actually found is that through the Wraparound process, by relying on that team, it's not only a lot more cohesive and includes all the systems that kids and family we're working with are involved in, but it takes the burden off of us. Like, it makes it a little bit easier.
Absolutely. And the other really cool thing about Wraparound is the fact that you have one comprehensive plan of care. So Wraparound is really designed for those kids who, this is high-level kids, kids who have a lot of need. And often they've touched several systems and they often have multiple plans of care, whether it be through schools, whether it be through probation or so forth. Whereas in Wraparound, we kind of bring all those relevant people to the table and to be part of the team, as well as natural supports, to come up with one comprehensive plan so that everybody knows what their part is to play.
And so to highlight some of the things that we call the most essential, or the 4 key elements for Wraparound in regard to the model that the state of Texas has adopted, we tie back to the National Wraparound Implementation Center, NWIC, as you see there as an acronym there. And their model is basically framed within 4 key components. So the first is, grounded in a strengths perspective. So what does that mean, Bonnie?
So it really means that we spend time identifying functional strengths both the family and team members bring to the table, and we actually use those to build off of with regards to the strategy development piece.
Right, and so the next one is, driven by underlying needs. So when we talk about needs in the Wraparound process, we're really talking about, what is really going on? What is an unmet thing that the kiddo and the family are struggling with that are causing the big behaviors that result in the referral to Wraparound? So it's really drilling down and trying to have a more targeted conversation around those behaviors.
And then the next one is supported by an effective team process. So we've already talked about the fact that one of the unique parts of Wraparound is that there is a child and family team. So this team that's a mixture of both those formal supports, so maybe a child sees a psychiatrist, or maybe school is involved because some of the big behaviors are happening there, but also that the team has those natural supports, so people that the family would naturally turn to during hard times. That might be an aunt, a neighbor, or someone like that, or someone else in the community. So the whole idea is that not only do we bring these people to the table to be part of that planning process, but their ideas are actually elicited for. So we want to know their perspectives on what's going on for this family, the strengths, the needs, as well as using those team members to come up with these strategies that's going to be really effective for this family.
Yeah, I'd like to add just a little bit to that, and we speak to it later on as well. But one of the things that's really cool about this is that we know that people are strengths too, right? So a lot of times when engagement breaks down in the wraparound process, what will happen is teams or care coordinators will come in and say, well, who do you want on your team? And the family will be like, nobody. There's nobody in my life that really want involved with this. But then they're turning around and they're texting people, or they're emailing or Facebooking or having lunch and dinner with them. And so those people that are relevant and real, being involved in the fact that, they see these big behaviors, they know what's going on. So why not have them at the table and figure out how they can help? And usually they bring a strength because there's a reason why they're involved with that kid and family's life.
And the other thing that I'd add to that is having those natural supports, those real and relevant people, part of the team is so crucial because they're the sustainable people for once wraparound ends. So keeping that in mind, even when teams first are created, is how are support systems going to be sustained after wraparound finishes? So that's another reason.
That's actually big key because we can't always rely on formal services to help these families out. We really turn on each other when we think about it. Like for me, for instance, when I'm going through a hard time in my life, I'm not going to turn around and call my doctor. I'm going to call my buddy I hadn't talked to in a while, or lean on a coworker or someone who's kind of been a support for me versus someone I'm paying to do it, literally. So the last one is determined by families, and it's not one that is last on the list for any other reason than it's probably one of the most important in regard to the fact that the families really have to drive the service array. They need to have choice in their provider network and need to be able to have some choice in the strategies and services that support them. So if you think about it this way, when you look at standard case management versus wraparound, one of the things that you see is that when something hasn't worked before, like it be counseling or skills training, sometimes what we think is we just need a new counselor, a new skills trainer, or we need to double the dosage, for lack of a better term. When the reality is if it hasn't worked, it's probably not
a good fit.
Not a good fit. So what is it that the family thinks could work, and what can the team bring to the table to help create some unique strategies around that? So Bonnie's actually put together, along with some help with some staff, some graduate students here at UT, an infographic on the difference between case management and wraparound, and we'd like to kind of share that with you a little bit. So if you don't mind, Bonnie, just high level, kind of walk them through this a little bit.
Sure. So one of the main differences around wraparound and case management is this idea that the families are involved in the planning process, like Erin was saying, whereas generally case management, we kind of essentially have a cookie cutter approach at times and say, okay, you have this, well, therefore you need this service. Another thing would be the fact that, you have a child and family team meeting in wraparound, and that's to occur pretty much once a month, which is requested and required, whereas in case management, there's no real set expectation for that. Another thing with regards to plan of care, we've already briefly talked about it, is the fact that we actually spend so much time identifying those functional strengths because we actually use them in planning. It's not, not only does it set a positive tone, but like I said, it's used in planning. Whereas often in case management, we more focus on those negative behaviors that we would like to see not happen, essentially.
So it's kind of like switching the hat from being solution-focused or treatment-focused to more focus on how to build up those resiliency factors. So those things that families do well and their teams do well, how do we build upon those to support them versus trying to throw some kind of treatment or service at the issue to see if it'll fix it?
Yeah. And another thing to keep in mind is, wraparound is targeted for families where, you've tried those services approach. You've tried that. It just hasn't worked. So we're not saying that there's not a time and place for that style, but wraparound is you've already been there and done that, so let's try something new.
So essentially wraparound is what you do when nothing else is working.
That's correct.
Okay. So switching back to the PowerPoint a little bit, I'm going to move on to who is wraparound for.
So wraparound is really for, kids who really have complex needs. So this isn't for, a child who, maybe has a bit of anxiety and just needs maybe a bit of therapy or something like that. No, this is for that top 5% of, intense support is really needed. And like Erin was saying, you've tried other things, and this family is also at risk of maybe the child to be placed out of the home and things like that.
Yeah, so what this diagram tries to do, it's taken from the system of care world, where you look at the entire level of promotion of health or mental health services within a service array, and you see at the bottom of the triangle, there's 80% of the population that don't need a whole lot. In the mental health world, it may just be some targeted counseling, like you were saying, Bonnie, or some med management, and it just kind of the kids are okay after that. But that middle 15% is where you need to do a little bit more, and so maybe it is traditional case management that works. Maybe it's skills training or a combination of that with case management. Maybe it's TFCBT or some other treatment, but it's more time limited, and again, it kind of fixes the problem. So that intensive level, though, is those top, like Bonnie said, that really top in kiddo and family, where all those other things just aren't going to work. And those kids are at risk of being removed from the home, whether relinquished because the family can't keep them in the home anymore, or because there's justice involved, they're going to be on their way to an RTC or a prison, or even if they keep cycling in and out of state hospitals because they're suicidal or homicidal. So if you're thinking about those types of kiddos and families that they really take 90% of your effort because they're so labor intensive, that's the type of family that's good for wraparound.
So this really summarizes all that we've said. Kids that have really complex mental health needs, kids that are at risk of being removed from their homes, nothing else has worked, and they're involved in numerous systems, that's when it's cool, because when they are involved in numerous systems, you can bring those people to the planning table to be part of the team. So that's why wraparound is so great.
Absolutely, and what's really cool about it is, as a really skilled facilitator, if you really engage juvenile justice and child welfare in the schools, they start to see the value of that, and that comprehensive plan then can serve as a cross-system, overarching plan of care that satisfies all those organizations' criteria, and makes the job a little bit easier for everyone involved, because nobody wants to see kids and families fail. So one of the things we wanted to highlight too is when you think about how it works within your system, thinking about from an organizational perspective, how do you align your organizational structures from supervision to workforce onboarding to your care coordination models, as well as basically your hierarchy of financial support for your workforce. Look at how you align those around the level of care of the kids and families that you're working with, and not so much around the contracts that you get. So what you'll see at the top of this slide to the left of who is wraparound for is a copy of that triangle again, remembering that the red part of the triangle is that top 5% of the youth and families that we partner with that are struggling the most, and then the green is that mid-level and the gray is the bottom level. So really start thinking about how you can align your organizational structures around how to support each one of those a level of need versus the funding stream that brings in the dollars. So here's an example of that. One of those would be a community mental health center, or in our state we call them a local mental health authority. And in our local mental health authorities, as of today, whatever day it is, August 5th, 2015, there's basically 3 types of funding streams that support high-end, high-need families. That is TACOMI, LOC4, and Yes Waiver. Now, all 3 of those are separate kind of models that are funded kind of similarly, but are looked at a lot of times as being independent programs. And what we've seen is a lot of our LMHAs, or community mental health authorities, will have separate supervisors for TACOMI, a separate supervisor for LOC4, and a separate sup for Yes. And that's not really a very cost-effective way to provide supervision support for your care coordinators when you align across all those contracts. And we're going to show you why in a second. So what you really want to think about is more around the level of need for support and supervision in your organization, and less focus on the bureaucratic paperwork around the contract requirements. And we know that's hard. It's one of the things that we have done a lot of work with community mental health centers around trying to work through. It is doable, and if you align right, you can actually show that it's not only cost efficient for your organization, but it provides better support for the system and allows your wraparound facilitators to grow their skill. Do you have anything you want to add to that, Bonnie?
Just the fact that, with wraparound in general, like wraparound facilitation, that's so different from case management. And just like how we're asking facilitators to sort of get outside their usual way of thinking on how to help families, it's the same with organizations. Like maybe there's things that you need to do to restructure in order for your wraparound facilitators to grow and for this to actually be sustainable for you all.
Yeah. So here's another example. We know that wraparound is starting to roll out in our state in some child placing agencies. And so within the child placing agencies, you have requirements around foster care, you have requirements around post-adoption, and now because of our managed care rollout, you are gaining some responsibilities around other behavioral health issues. Again, just like with the community mental health model, what we encourage your organizations to think about is aligning your infrastructures around that red triangle. Like how can you, if you're going to do wraparound with kids in foster care or wraparound with kids in post-adopt or other behavioral health organizations, instead of seeing those as three separate entities, align around the level of care needs. So you would literally have a supervisor or a team of supervisors and a care coordinator or a team of care coordinators / RAP facilitators that support those high-end kids despite whether they're in foster care, post-adopt, or other behavioral health. And so that ties into some of the reasons why we highly recommend that the organizations think about prepping before it gets involved with the wraparound process. And so we're just going to briefly kind of go over a little bit about what implementation science is. So this is, I wouldn't say so much a new science, although it's starting to get a lot more buzz around it. But basically it's research that's been done globally around what does it take for an organization to actually implement an evidence-based practice in an evidence-based way. Like it doesn't do any good to take a really good intervention and throw it into an organization and try to see if it'll work if the organization isn't prepared to support the intervention. And so what it's basically framed around, as you see in that triangle at the bottom, is looking at the organization and whether it's got its structures in place so that the systems level intervention and the administration is there to help support that systems level intervention, and that it's using data to define or help to tweak the intervention as it goes forward. And so there needs to be some support from leadership, as you'll see at the bottom, moving from that more technical aspect of supervision or leadership to an adaptive model, which means when do we look at our organizational forms more so or less so and actually look more at our organizational processes. And then ultimately making sure that we set up a situation where we can help staff grow competency within the model, all the way from selection, so who do you hire, how do you get them there, how do you train them, and then how do you provide coaching support. So we're going to go in a little more detail about this as we go forward, but one of the things I want to preface this with is that when you're looking at hiring both your line level RAP facilitators and your supervisors, all of these three key components need to be thought in. How is the organization going to structure itself so that the administration can support the supervisors to have the adaptive leadership that they need in order to help their staff gain competency in the skill?
So here is now some practical measures that we have done to help prep organizations to roll out wraparound. So one of the first things that we actually did was sort of engage conversation around sort of leadership at organizations. Is the leadership bought into wraparound? Has the leadership had conversations with the community to engage them in this new thing called wraparound and also provide a development piece? The wraparound teams, have they thought about, not only how many wraparound facilitators and supervisors they need, but is the environment going to be a place where they can grow in their skill? Do we have a provider network base? Like when we were talking about brainstorming strategies, well, we need the community on board to also show what they could offer as well. Like I said, do you know how many families are we expecting who would be, be in wraparound, so to speak? That's good information to know up front so they can plan for hiring staff and so forth. As well as quality indicators. So we're making sure that does the process run smoothly? Are we using that information to sort of roll back and sort of make some changes as they're needed?
Yeah, so real practically what we're talking about is not only do you have the right people in place, but do you have enough information to inform your organization on whether you have the right plan in place to make sure that you have the workforce develop with the needs of your community. And that could be the number of kids and families that are coming in that need wraparound. Are you thinking far enough in advance to hire and sustain workforce to keep that? And then also, do you have the services in your community that these kids and families can be referred to help support that? So that provider network piece is an ongoing development of the child and family team process. So families know who they go to, and they're always informing that back to the organization. And so that's all one big cycle. So your quality indicators come back and they form leadership, who then informs the community, who then informs the teams, and then those teams help inform the provider network, and we're constantly planning for targets. So it doesn't really ever stop. So one of the things that we really suggest that you do, and we learned this through our rollout of wraparound through our 1915C waiver or YES waiver here in Texas, is that you first really need to think about your strategic planning. Make sure the leadership is bought in and that the org is structured in such a way that you can support it. And one way to do that is through the process of using something called the process mapping effort, where you actually look at where in the process you might have some inefficiencies or gaps in your referral and engagement process, so that you can strengthen those before kids and families start to touch your system. And so what do you mean here, Bonnie, by involving RAP facilitators during the intake process?
Well, one thing that we know about families who would benefit from RAP is that these families are in and out of crisis. So if there's anything that we can do to sort of help with that engagement, it's great to do so. And one of the things, practically speaking, is often during an intake process, a family might speak to several different people, and then by the end of that, they're probably exhausted, and then, hey, maybe that sets off another crisis. You never know. But is there some way we can kind of streamline that approach so that the amount of people families talk to is limited, as well as bringing in really that wraparound facilitator as soon as possible, so they can actually start building that engagement piece and that relationship with the family as soon as they enter the organization?
Yeah, the sooner the better. Yep.
Essentially
because of that engagement piece, and also because the process can start. There's no need to wait on it.
So another thing that we sort of spent time talking with organizations about in rolling out wraparound is to think about your hiring practices. So every organization usually has their own protocols on how to hire and who to hire and things like that. And we sort of say that with wraparound, maybe rethink that hiring protocol when it comes to hiring a wraparound facilitator. For instance, one thing that you might want to consider is actually having someone on the interview panel that has had wraparound experience who could just speak to the day-to-day tasks of what life is like as a wraparound facilitator. For instance, it's not a 9 to 5 kind of job. I mean, you have to be a little bit flexible. You might have some flex time and things like that. So just being able to be real and honest during the interview process can really help you know who's going to be a good fit for that position up front. The other suggestion that's been made is also actually having group interviews. Because one thing that's unique about wraparound facilitators is that they need to have the ability to actually manage and facilitate a group and talk about some difficult topics and just, having those group management skills in general.
That might be a little uncomfortable, but you get to learn real quick who can handle their own in that group process, wouldn't you?
Absolutely.
Yeah.
And one thing a story that I heard is that during this group interview practice, one organization, what they used to do is actually give these potential hires a family story, 3 sheets of paper, and actually ask them to identify strengths and needs and strategies and essentially create a plan. And they literally sat back and observed to see what were their social skills like working in a group setting. Were they able to identify strengths and things like that? So you can get a lot from doing a group interview. So maybe that's just another suggestion of how to hire.
There was one that someone told me, and I thought it was kind of fun. It would be something I would do if I was hiring, and it's where they literally put all the candidates in the same room and had them tell a little bit about each other to each other. And then the exercise was, hey, candidate on the right, you now have to turn to candidate on the left and tell me why I should hire them instead of you. And so you basically have to be able to pull out strengths amongst your competitors. And I thought, that's kind of a creative way to really put people on the spot. And one, you'd really know who could hold their own yet again in a kind of a tense situation.
So another thing to consider when you're working with staff, whether it be facilitators or supervisors, is to actually spend time in defining the role that they play. And I know this sounds very sort of common sense, but often we find with working across the state is that wraparound facilitators are often confused and start start thinking about case management skills and case management role that they had. So having that clear role and job description up front really helps them sort of know what they're striving towards, and also knowing when they're doing a good job.
Yeah, that rolls right in to make sure that you communicate your expectations and your non-negotiables. So basically saying that you're a wrap care coordinator, you're not the skills trainer, you're not the therapist. Your job is to facilitate a team of people that may include skills trainers, therapists, equine therapy, other folks. But your role is to really about building in, within those 4 key elements, the process. And basically making sure that you're also holding them accountable. So like setting the minimum expectation that with all the families they partner with, they actually have a team, and that team includes both formal and informal supports, which we'll talk to a little bit more in a minute.
And the other thing is, obviously providing an environment where staff can become more competent in their wraparound skills. So being able to send them to trainings, as well as sort of investing in coaching, because we all know that once we're being taught one thing, we go away and try and implement this new thing, kind of like learning how to play a new sport or something like that. It's that constant coaching piece that you'll actually see that skill development happen.
Yeah, I like to equate this to learning a new language or learning how to play an instrument. You literally cannot go to 3 days of training, come back, never practice, and expect to learn it. So you have to try it, and you have to have someone who helps you tweak it as you're going along. And so lastly, you want to make sure you're also looking at your data and looking at your management of the wraparound quality. So looking at your outcomes. So if you see that you're having high hospitalization rates, high rates of kids and families that are kind of getting closed early in the system, or that you feel like the family stories are starting to break down, making sure that you're consistently being involved in the day in and day out activity of what wrap coordinators are doing or wrap facilitators are doing, from a supervisory perspective and then from an administrative perspective, that you're getting the outcomes that you want. Because I guarantee you, if you're not getting the outcomes that you want, wraparound isn't happening.
So just thinking about wraparound facilitators, things that you want to look for is the fact that they can have the ability to engage with a variety of people, because we know that one of their tasks will be to create this child and family team that needs to consist of both those formal supports, so for instance maybe a therapist of some sort, but as well as those natural supports. So sort of seeing that they have those skills is going to be really important when it comes to hiring.
Yeah, so you don't want to hire people that essentially are wallflowers, that they don't want to get out in front of a group of people and don't have the ability to basically strike up conversations. Like, that's a pretty important skill to have. Not to say that wallflowers couldn't also do it, but you're looking for people that are willing to get out of their comfort zone or live comfortably in that kind of environment.
And so I guess that kind of feeds into working within that team environment and facilitating a group.
Mm-hmm. And being open-minded and creative. So sometimes you got to be able to think on the fly. And interestingly, some of the most creative wrap facilitators I've seen are actually folks that have come from like the public education system, like teachers. There's a guy in the Valley, it's a formal journalist that I think is really phenomenal. So, people that can really kind of be on their own and be able to work with where the families are and their teams are at that point in time is a really intense skill to have.
And I like that you brought that up, because that's when it's very different from case management as well, in the sense that, with wraparound, there's no cookie cutter approach to anything. I mean, yes, there's a process that we all follow with regards to wraparound phases and specific tasks, say, that we need to do as a facilitator, but how we go about doing that and how we sort of bring a team together and how strategies are developed and things like that, that's unique for every family.
Mm-hmm. And so you have to be able to go with the flow, or it's just not going to happen. So with supervisors, kind of similar. We know that they're going to work across the department. They need to understand different systems and different protocols within the agency. But rather than building skill around what we typically do as soups, which is those case-by-case staffings, like tell us what's going on with that family and here's how we can fix it. We want to build skill around them being able to talk about the process and where the process is broken down or where it could have broken down. So some of those are ensuring that there's clear expectations, as we said, but also that there's ongoing growth for competency training and coaching.
And so for more information about hiring, who to hire and how to do this, we actually have created a resource that you can download as well. That'll be at the end of this webinar.
Yeah, so we'll post it alongside this. It's called the Hiring Practice Resource Guide, and we'll have it on the website. So next we want to talk about cost neutrality. So this is all well and good. So we know that wraparound is good, is a great way to work with children and families. They're in the top tier, or have the most complex mental health needs within our systems. We know that we got to create space for skill attainment and competency. But so what? If the organization is hemorrhaging money, like if you can't make it cost effective, then why do it? Other than the fact that you have better outcomes, which are great, and this is what we're in the business of doing. But one of the things that we've also wanted to help organizations think through is how can you set it up in such a way that by doing high quality, high fidelity wraparound, you not only have better outcomes for children and families, but your organization at least achieves cost neutrality. So there's a couple of tools that we have included along with this webcast. We're going to kind of walk you through a little bit of them to help you think that through. So the first is the time study.
Do we first want to talk about the ratios, like how to do wraparound to quality? That impacts that?
We can.
Up to you.
Yeah, let me do that then. That's fine. Oh, you're talking about the next part of the PowerPoint. Just kidding. It's almost like live, not Memorex. Okay, go ahead.
So for high quality wraparound, and I think this is just important to keep in mind when we do go into talking about costs and things like that. So with high quality wraparound, you know, the ratio for a wraparound facilitator to families is 1 to 10. And we actually have shown, have research to show that if you go beyond these ratios, you actually can lose money as well as the quality goes down.
Yeah, so I think we're seeing around 12 families.
12 families.
When you start to lose the ability for those outcomes, like you said, but also from the cost neutrality model, you start to spend more pennies as you're failing.
Yeah. And so the ratios for supervisor to wraparound facilitator is 1 to 7. And team lead, and I'll just quickly say what a team lead is. So team leads essentially kind of act as kind of a semi-supervisor, but also have a caseload for themselves as well. So some smaller organizations have utilized this model because it's more cost efficient for them and it just makes sense. And so ratios for team leads to families is that they would only be working with 5 families and then 5 facilitators for the supervision part.
Yeah. So what was helpful with that, for instance, let's say as we're walking with an organization that has maybe 3 contracts, for instance, like the Tacoma, the LOC4, and the YES waiver for our community mental health centers. You may only have 2 kids in the Tacoma package and 1 kid in LOC4, but then you have, 9 families in YES. What do? It doesn't make a lot of sense to have a supervisor and a facilitator for all 3 of the, each individual in those 3 contracts. So it makes a lot of sense, though, to have 1 supervisor. So now we have, 14 kids in care and 2 care coordinators in that model. And then what you do by creating the team lead is you allow those to grow. So you can build by doubling. So the next thing you know, you have a supervisor and 4 care coordinators. And as those care coordinators get larger than the 1 to 7 ratio, you bring in a team lead so they keep that ratio down. And that way the organization can continue to support in 2 ways. One, it creates a hierarchy for case managers or RAP facilitators so that they have a chance to be a team lead at some point. And it also takes some of the supervision burden off the supervisor because they can now share that with the team leads. The third thing is that it allows for is workforce planning sustainability. So as RAP facilitators quit, leave, are asked to leave, have to take vacation, have children, the team leads, because they're carrying a partial caseload, could then step in and cover those positions while they're out. So we really encourage the team lead model as organizations go forward, but sometimes you have to build towards it. So yeah, thanks, Bonnie. That was a helpful suggestion. So what we want to show is this time study, and the font's kind of small, but again, we are also going to have this available on our website. What we're showing you here is that there was the results of a multi-state study that was conducted by the National Wraparound Initiative, now the National Wraparound Implementation Center, about what does a RAP facilitator do with their time if they're doing high quality and high fidelity wraparound. And so what you'll see here, we're not going to walk through all of it because you can walk through this doc on your own, is that with a caseload of 1 to 10, there is on a monthly basis at least 20 months of face-to-face billable time being conducted for team meetings. That's how that works. So you see time spent per month next to team meetings, it says 20. Face-to-face is yes. So it's face-to-face. In most states, that means it's billable to Medicaid. So then we also accounted for the setup time for the meeting. So you'll see there the time spent for that is 10 hours. That's 1 hour per family on caseload. And again, that's no. So that would not be billable. That's the way this chart works. So what you see is for a typical 1 to 10 care coordination model with at least 4 additional team members, a WRAP facilitator doing high quality, high fidelity wraparound would be able to spend 148 hours per month with the family. And then you look at crisis, same with the crisis, so that's broken down with a 1 time per family per month, with the thought around at least 1 family to 2 families a month are going to have some kind of crisis. And then breaking it down between new families and ongoing tasks. So when you drill it all down, is with that model, what the multi-state study found was that on average, a WRAP facilitator doing high fidelity, high quality wraparound with a 1 to 10 family ratio was able to bill 70 hours a month in reimbursements. So where that ties into your cost neutrality is this worksheet here that I'm bringing up. So what we've developed is this guide that you can use. So you can look at the cost that it takes for your organization to hire a care coordinator or WRAP facilitator. So that's your case manager level position as a full-time employee, and you put it in the chart there to the right. Next, you want to look at that supervision. So we really encourage the supervision support, and again, that ratio is 1 to 7. So you want to look at the cost for a supervisor and then divide it by 7 and then put that number to the right. And then sum that up, and that'll give you your total salaries, and then multiply that by 25%, and that gives you your fringe rate. So the other things we've included are things that people don't typically think about as being costs associated with doing wraparound, so like rent. So the national average is around 144 to 146 square feet per office space at around $15 per square foot. So about $26,000 a year to office space for a WRAP facilitator, along with communications, and then mileage. The average mileage that was found, or actually it was the mean mileage that was found in that cost study, multi-state cost study, was around 10,500 miles a year. So at 55 cents a mile, you look at that, it's going to cost you almost $6,000. And then we also want to make sure you include indirect. So the indirect rate comes in when you're talking about things that are essential, like, I don't know, toilet paper, like you kind of have to have that at the office, the guy who empties the trash, the copier, the secretary time. So you want to multiply that in there and then add all that up, and that's going to give you your full-time care coordinator. And then in Texas, so if you're not here, this rate's going to differ, but in Texas what we've done is we went ahead and looked at what you would earn if you were billing 70 hours a month per care coordinator at the intensive case management rate of $126.76 an hour. And what we see is that for the 1 care coordinator position with a supervisor to 1 to 7, an organization can bring in $106,000 a year. So once you tally all that up, what you'll see is you subtract how much revenue you can bring in from how much it costs to support that position, and that'll give you your about net return. So all that to say is that we hope that those are helpful to you as you start thinking about how you can realign your hiring structures, your supervision ratios, and then basically your salary scales so that they can align with supporting the cost neutrality of the model.
So next thing to think about is that continuous quality improvement. So we want to make sure that, we know that wraparound is difficult skill. So what can we do to see how growth is occurring, to see where some supervision might need to target? So one of those things that you could do is literally look at child level outcomes and case level outcomes. That can give you a bit of information, as well as looking at formal assessment measures such as the CANS, which is what we use here in Texas, as well as eliciting that feedback from family and staff to see how they think the process is going. Did you want to talk any more about that?
Yeah, sure. So basically they have satisfaction surveys that can be done. But a good thing to do in supervision is just ask your staff, how's it going? How are things? Once you're trying on the model, how much different is that now than it was when you were doing normal case management? Is it easier? Is it harder? Really providing feedback to them about how can the wraparound process actually make their job a little better. And then encounter code, so what we're looking at there is what are they doing? So if we just walk through this billing structure with you, we know that families, care coordinators or RAP facilitators that are doing high fidelity wraparounds will be billing to 70 hours a month in intensive case management. Does your billing code support that? So if you go back and you run the data, that should tell you alone if they're actually doing it or not.
And so without the model of wraparound that we use here in Texas, the NWIC model, some other tools that they've provided that can help with this quality improvement measure too is coaching and supervision reports. So in those reports, it really highlights, the strengths of the supervisor, as well as some specific skills that they could target to sort of improve their practice.
And then there's the Wraparound Fidelity Index. So that kind of ties back to what Bonnie was talking about earlier about the family and staff feedback. So the WIFI, as we call it, and we're going to use the WIFI EZ, the EZ version here in Texas, basically is a structured survey that provides feedback from both the facilitator as well as the youth and the family around their perceptions of how wraparound is functioning.
And next we have the Coaching Observation Measure for Effective Teams, otherwise known as the COMET. And that essentially is this assessment piece that targets 40-something different skill sets that a wraparound facilitator can demonstrate. So we essentially do this assessment, and it can be through supervision or looking at paperwork and things like that. But it's really to highlight what skill sets the wraparound facilitator has mastered, as well as what skill sets they need more support around.
Right, and then so when at the supervision level, one of the things we want to support agencies in doing is being able to use this coaching response to enhance skill transfer, or CREST, to provide that ongoing feedback to the staff or the RAP facilitators about how things are going. So the caveat that I have to kind of put out there is that none of these tools are available to everyone in the state of Texas. So essentially, if our institute is working with your organization, provide coaching support and other fidelity support, then we would be able to give you data back on these tools. If your organization is not contracting with us to do that at this time, then unfortunately these are not available to you. However, we're happy to help you figure out ways for you to structure your supervision locally and your structures locally to analyze your own data so that you can figure that out, so you're not limited in what you can do.
And so finally, the benefits of spending time to prep your organization to roll out, well, I mean, there's heaps of them. Some things simply is the fact that you can really develop that wraparound skill in your facilitators and supervisors, so you're actually producing quality wraparound.
Yeah, and then also that you make sure that your organization is going to be supportive. So that's a big investment. If you send staff to training, not only is it the cost of the training and the time away from the office, but it's the time that everyone takes when they come back and they're trying it on. So if you're really trying to invest in wraparound because you want to see the outcomes, you absolutely have to make sure the organization is set up in such a way as aligned in the implementation science so that it supports that ongoing skill attainment, or it's kind of wasted time and wasted money.
And so if you've spent time also looking at your hiring practices and you have an environment that can build skill, well, that will mean that you'll have less staff turnover, and it's also going to be sustainable for your organization. Like Erin was saying, you put all that hard work in, and so hopefully we keep these people, and that's going to be, we know how to sustain this for the future.
Yeah, so it's like hard work in and hard work out, right? Mm-hmm. So what we've actually seen in other states and a couple of organizations here in Texas that are up and running is that when wraparound is supported in an organization and being done and practiced in a high quality and high fidelity way, that the actual staff are happier, mm-hmm. the organization is actually a lot more successful, and the families ultimately, which is what we get in this business of doing, are a lot more successful. And so, we really can't emphasize enough, if you're going to try to implement wraparound in your organization, to please at least consider the organizational schematics of it, your supervision support for it, the ratios are absolutely non-negotiable, or you're really just not going to get any of the bang for your buck that you're trying to get. What are your last parting thoughts, Bonnie?
I think just, it is a lot of upfront hard work, as an organization as well as a facilitator in helping families, but the outcome means, families are successful, and as an organization, you'll be successful if you spend time doing all this hard work up front. So why not give it a go?
So the last thing I would say is, after you viewed this webcast, if you really are interested in learning more about wraparound implementation, at least in Texas, please go to our website. We have our main website is the Texas Institute for Excellence in Mental Health at the University of Texas at Austin. You can literally Google that and find us. Our companion site is Texas System of Care. It's actually txsystemofcare.org. I said that wrong earlier in the webcast. So that's txsystemofcare.org. You can find resources for Texas-based implementation on both those websites. If you'd like to learn more about what's happening nationally, you can go to the National Wraparound Implementation Center. Google that. It'll take you right there. Or the National Wraparound Initiative. Either one of those will show you what our partners federally are doing. So what I would say is kind of like, let's wrap up our wrap talk. Is good luck to you as you invest in your efforts and time, and we look forward to working with all of you all or hearing from you soon if you get interested in learning more. Thank you.